Hello, it's Dr. Rhonda Johnson, and I'm going to be talking about getting a flu shot in this time of the COVID-19 pandemic. So you probably want to know, is it safe to get a flu shot? Do you have to worry about getting COVID-19 from trying to get a flu shot? Well, the answer is most healthcare providers and flu shot clinics will have social distancing in place. The staff will be wearing personal protective equipment. This is pretty standard now. Now, you may have to answer some questions about COVID-19 prior to getting your flu shot, and some places that you go might require you to get a temperature screening. My next question is, will a flu vaccine protect me against COVID-19? Folks, no. There's no known protection or there's no vaccine yet that's been licensed to prevent COVID-19. The best way to protect yourself is by practicing the 3 W's, but you still want to get the flu shot to help prevent the flu so you won't get the flu and COVID-19 at the same time. So the next question is, who is at high risk for the flu? And that's basically anybody who's in contact with people, essential workers, and also the very young and the adults who are 65 and older are at high risk for complications from the flu, particularly if they've got lung disease or diabetes or other chronic conditions. The next question is, should you get a flu shot if you have suspected or confirmed COVID-19? The answer is no. You should not be receiving any vaccines if you have suspected or confirmed COVID-19 because you're supposed to be in isolation and you can't come out of isolation until you're no longer contagious. And so you don't want to be going out to get the flu shot. And always talk with your doctor if you're unsure about when you should discontinue your isolation. The last question is, if you were recently diagnosed with COVID-19 and you have recovered, when should you get the flu vaccine? And that I recommend discussing with your healthcare provider. Again, you don't want to get the flu shot while you're in isolation. And most people want to check with their doctors about that. One more question. Can you get a vaccine if you have a mild illness like a cold and a negative COVID-19 test? Well, typically, it's okay to get the flu shot if you have a mild illness like a sinus infection. However, during this COVID-19 pandemic, it's hard to know who has COVID-19, and many people can have COVID-19 and have a negative test. So I recommend waiting till all of your symptoms are resolved and then get your flu shot. Lastly, can you get COVID-19 and the flu at the same time? Yes, it is possible to get the flu and COVID-19 and be sick from both of these diseases at the same time because COVID's going around in your community and the flu is going around in the community. So getting a flu shot is the best way to protect your health and your family's health this season during this pandemic.